Hi, I'm Gavin Routledge, Clinic Director and Osteopath at ActiveX Clinics. Low back pain. Low back pain is extremely common. It affects about 80% of all adults at some time in their lives, and approximately 20% of the adult population are classified as chronic low back pain sufferers. So what causes lower back pain? Well, there are many causes. The vast majority of them are not serious. You may require some help, but in many cases, lower back pain resolves on its own. In order to maximize your chances of getting over lower back pain, it's important to understand the cause and to know how to manage it. So we'll cover that very shortly. Firstly, a little model of the lower back. This is a vertebral column, a spinal column. This being the back and this being the front over here. These knobbly pieces down here you can see are the knobbly bits that run down the centre of your own back. Now, people often get very hung up on what can go wrong with the spine. Is it a disc problem? These little bits in between the bones are discs. Is it muscular? Is it ligamentous? Regardless of the cause, the management is often very similar in terms of what you should be doing. But certainly the causes of lower back pain are many. You can have disc problems, ligamentous strains, muscular pulls, all sorts of other syndromes, piriformis syndrome, nerve root irritation, many things that can cause back pain. And really, in order to get an accurate diagnosis, you'd have to go and see an osteopath, chiropractor or physiotherapist. In general, we can say that people who suffer chronic or recurring lower back pain are much more at risk of that if they are overweight. Smokers, interestingly, suffer if they suffer more stress, particularly work-related stress. If you do a heavy manual job or even a repetitive, relatively lighter job. So there are all sorts of things that can predispose you to becoming a back pain sufferer. And if you can identify a pattern in your life, for instance, if you do a certain type of physical activity and your back pain gets worse afterwards, then clearly that's a contributing factor to your back problem and one that you need to address. So what are the causes? They are many, usually lifestyle related, and those are things that you can do something about. So look for a pattern and try and eliminate the aggravating or the factors that seem to make your pain worse. What should you do about it apart from that? The simple principle is use it or lose it, but don't abuse it. So that summarizes for me. Use it or lose it means if you don't keep your back moving, it will stiffen up. Often the muscles will weaken in the long term, and you end up much more likely to suffer a recurrence of back problems. The don't abuse it principle simply means if you do something that hurts, your lower back is less likely to recover. So the use it or lose it, but don't abuse it principle applies really across the board to any problem which has come on recently. And by that I mean really within the last 6 weeks. Beyond 6 weeks, and particularly beyond 3 months, we would classify your back pain as being a chronic pain, and the advice does change slightly with regard to the don't abuse it principle. And I'm not referring to no pain, no gain, but sometimes there is an argument, particularly with longer term problems, to do some things despite pain. But really, if you fall into the chronic low back pain suffering category, you'd be as well to seek more direct personal advice. So what should you do about it? You should retain as much physical activity as possible without making it more sore. Use it or lose it, but don't abuse it. Who can help you with your back problems? As I mentioned earlier, registered osteopath, chiropractor or chartered physiotherapist can often help with lower back problems, and indeed they are recommended by, research indicates that particularly for acute short-lived back problems, all three professions can benefit low back problems. So if you Google or search online, you will find there are registers for each profession. Some people specialising in chronic low back pain. We do, particularly at our practice. So have a good look online. Ideally, it's nice to get a personal recommendation, but sometimes people who are listed online will have recommendations from past clients, testimonials. So there we are, lower back pain, very common. The causes are many. If you want an accurate diagnosis, you really have to go and see a professional. What you should be doing is keeping the whole thing moving, but trying to avoid things that hurt, and seeking further advice and treatment if you want to get better that bit faster. If you'd like to contact us, you can reach us at www.active-x.co.uk. And as I say, we see lots of people with lower back problems and we'd be delighted to help you too. Okay, bye-bye.